Okay, so good morning, everyone. We've completed a bunch of systems already. Now we're going to do a pretty quick system, the urinary system. And you'll find that a lot of the next couple systems, there's overlap between what we've done already with the respiratory tract um, and some of the other systems, primarily because a lot of the actions will affect multiple systems. So with the urinary system, the main things I would say that we treat in the urinary system would be primarily infections. Urinary tract infections would be the first thing, and occasionally maybe stones in the urinary tract. Now, when it comes to treating any sort of conditions of the urinary tract, one of the ways that we sort of help to get rid of the problem is to flush out the system. And the way that you do that is you take a herb that has a diuretic action, and diuretic increases the production and elimination of urine. And so I'm sure everyone has probably had a cup of coffee or tea at some point in their life and notice that it makes you have to go to the bathroom and urinate more. So that would be a diuretic effect that everyone's experienced. Now, where you would use this is if someone had an infection, you just want to flush out the urinary tract as much as possible, because if you're producing and eliminating more urine, it just basically acts like it just kind of helps to flush out the bladder and the various tubes to prevent the bacteria from adhering. So just imagine if you have a bucket of water sitting in your backyard, um, just stagnant for the whole year, or a pond or a puddle, things start to grow in it. And if you stick a hose in there and just leave it on, even just trickle, or you turn it on full blast, it just flushes everything out. And that's the purpose of a diuretic. It's a very simple physical effect it has on the system. In addition to urinary tract infections, you would use this for things like kidney stones or gravel in the urinary tract. So sometimes people will produce calcium oxalate. It's one of the more common stones, um, and they can be quite painful. And so by increasing urine production, not just by taking a diuretic, but I want to add that you also need to drink more water as well. So it's a combination of taking something that has a diuretic action and increasing your fluid intake. Also, diuretics can be used for detoxification. So some examples of this in clinic is occasionally, or actually quite frequently, when people have food sensitivities, they may be retaining water from after they eat a food sensitivity. So we might recommend some type of diuretic tea to help get rid of that extra swelling. And so sometimes people will feel puffiness and edema in their hands or their feet. You might use a diuretic also to remove that extra water that's in the interstitial space. So another example of that might be women around their period. They might retain a lot of water. So a diuretic could be used for that as well. So there are a number of herbs that have this action. Some common things: parsley, the same spice that you use in your kitchen. It's historically been used as a diuretic and has been used for urinary tract infections. It's a very gentle thing you can use. Juniper, sorry, I'll show you some photographs. Juniper, which is shown on the left there, it's a coniferous tree that produces a lot of resins and oils. And so I'm sure a lot of you have smelt or tasted gin before, and gin is extracted from juniper. So there's a lot of phytochemicals in juniper. And most plants, when you think about it, like pine trees, uh, balsam firs, like Christmas trees, tea tree, eucalyptus trees, all these trees have a lot of volatile oils, and many of those volatile oils, they have a very slight irritating effect to the mucous membranes in the kidneys and the urinary tract, and that helps to increase blood flow to the area, and basically increases the production and elimination of urine. So I would imagine that some of the actions associated with these diuretics, and parsley has a lot of essential oils in it too, is that these essential oils, if you were to apply them topically, they'd act as a rubefacient to cause dilation of the capillaries. But internally, you won't really see that action, and in the urinary tract, it may just increase the blood flow to the urinary tract, and that produces more urine. We're not sure exactly how they work. They may be affecting certain transporters involved with regulating salt. That could be another way. Another thing that's interesting about juniper is juniper contains terp4-ol, which is a type of essential oil that's found in a number of plants, but in particular it's the main active ingredient in tea tree. So juniper oil has some similarities to what you're going to get in tea tree oil, and you would want to be careful about taking the pure juniper oil internally, but certainly as a tea or a little bit of gin would probably have an antiseptic effect and a diuretic effect. And most essential oils in general do have that antiseptic property that we described already. Now, urinary antiseptics, this is basically some kind of chemical that inhibits the growth of microorganisms. And we've already discussed this a little bit just 1 second ago. So juniper, bearberry, and parsley all contain essential oils that have this antiseptic quality, and eventually they make their way through the body. Once you take them internally, they'll be excreted through the kidneys, and that's one of the ways that they get eliminated. Now, one classic example of a urinary antiseptic, and I would say this is the most famous one, is bearberry. So bearberry, Arctostaphylos uva ursi. This is a cousin of the cranberry. Pardon me, cousin of the cranberries and blueberries. It's in the same family. Now, what's unique about this particular plant is it contains a very interesting compound called arbutin, and it's a hydroquinone glycoside. And we'll talk about these compounds a little bit more after the midterm. But the way that it works is arbutin is basically a compound called hydroquinone with a glucose molecule attached to it. And we're going to talk about these compounds that are referred to as glycosides later on. But one of the reasons why the plant attaches a sugar onto it is essential oils will evaporate off and disappear if we don't stick a sugar onto it. So what the sugar does is it makes the molecule heavier. It also makes it water soluble, and it also helps it make its way down into the kidney. So when you attach a sugar onto something, it improves the storage and the elimination of these various compounds. Now, what's interesting about this is arbutin kind of acts like a mouse trap for bacteria in the urinary tract, in particular E. coli. So not all bacteria will respond to arbutin, but certain bacteria, including E. coli, which is the main cause of urinary tract infections, it contains an enzyme called beta-glucoxidase. And what it does is this enzyme is responsible for cleaving the sugar off of the hydroquinone molecule, or the arbutin molecule, releasing the hydroquinone. Now, so imagine this. You consume the herb, the bearberry, the arbutin gets absorbed, makes its way down to the bladder where the infection is, and then when the bacteria see it, they like the sugar because the sugar is a good fuel source, so they eat the sugar, which is a little bit like a mouse eating the cheese or peanut butter or whatever you put on your mouse traps. And then when it removes the sugar, it then releases the hydroquinone. And hydroquinone is a relatively small molecule that has the potential to undergo a redox reaction to basically accept and donate electrons to reverse back and forth from hydroquinone to quinone. And by doing this, it generates free radicals in the process. And so, one, it's going to disrupt the cell membranes because small molecules, most of these essential oils will just disrupt the cell membranes and make them more leaky, and that makes them more susceptible to damage. So some of them will lyse. The other thing that'll do is that by the generation of the free radicals, it can destroy or disrupt some of the proteins on the surface or inside these bacteria and weaken them further. So it's not really a true antibiotic that has a precise target in the body. It's more that when hydroquinone gets released, it just sort of messes up the cell membrane. I'm sure it reacts with some proteins. It probably has an effect on DNA. So it just sort of weakens the system. And the nice thing about a herb like bearberry is, in addition to having this urinary antiseptic effect, it also has a diuretic effect. So you're weakening the bacteria, and then also you're flushing it out by having the diuretic action. Now, another important mechanism is an anti-adherence effect. Now, I'm sure everyone's heard about cranberries and how that they can be used to treat urinary tract infections. And when you look at the research around cranberries, there's a lot of positive research on it. There's some research that shows no benefit. It's a little bit confusing because you have to look at the dose that's given. Maybe the type of bacteria that the patient has isn't going to respond to the cranberry. But certainly it's worth trying. And the benefit of trying something like cranberry first is that, one, it's not toxic, so there's no harm in using it. Two, most urinary tract infections are self-limiting, so if you just drink more water, it's going to go away. So if you drink more water and have a little bit of cranberry juice right off the bat, that might just flush it out of the system. And three, it's a lot safer than antibiotics. And one of the problems with starting to take antibiotics for urinary tract infection is they may work now, but resistance can occur. Also, some people will get serious drug reactions to them. And third thing is they're not always necessary for urinary tract infections. And fourth thing is it messes up your gut flora and can increase your risk of getting a yeast infection. So I think there's a lot of potential to use herbs for urinary tract infections. Now, if you treat a urinary tract infection and within a couple of days the person's not responding and they're getting worse, or if something serious happens, like they start developing a fever, that suggests that the urinary tract infections ascended into the kidneys, and that can become a very serious thing. So herbs can be beneficial. They often don't work for serious infections, and I would say that with a lot of patients, sometimes they'll come in and they'll take an antibiotic, and the first antibiotic won't work, and they'll take a second one and a third one before it finally works. So, we have to be smart about treating patients, and I think it's good to consider using antibiotics, but certainly not necessary as your first line treatment. I think drinking water and taking a few herbs and maybe some cranberry juice and stuff might be enough for 80% of the patients. But it's always good to make sure that you refer people if it gets worse. There's nothing wrong with that. We have our strengths and weaknesses, and limitations. Now, when it comes to cranberries, the way that cranberries work for urinary tract infections is they have a urinary antiseptic effect through this anti-adherent action. Now, as we mentioned before, with the anti-adherence effects in the respiratory tract, cranberries basically have sugars, and that red color you see in the cranberry on the left-hand side, that's an anthocyanin that has it's a tannin that has an anti-adherence effect as well. So it clings to the feet of the bacteria of E. coli and prevents them to attaching themselves to the mucous membranes of the urinary tract. Now, in addition, cranberries also been shown to have some beneficial effect on helping to prevent gingivitis and also stomach ulcers, because it'll attach to H. pylori. So one of the things that I find interesting is, in general, I'd say fruits and vegetables have the potential to help prevent the adherence of bacteria. So when you look at even people who are eating fruit, although fruit's high in sugar, I'm sure there are other compounds in lots of different types of fruits that help to prevent gingivitis and tooth decay that you won't find in just eating candy, which is high in with maybe the same amount of sugar. Anyway, so cranberry has a number of different actions. The nice thing about cranberries is that red color in it. That's also a great phytochemical that helps to prevent oxidative stress. It's good for the cardiovascular system, helps prevent cancer. So even if cranberry juice was ineffective, it does act as a serving of fruits and vegetables to prevent a number of degenerative diseases. So I think it's a good thing to take at the beginning of a urinary tract infection. You just got to make sure you get the right dose. Some studies that show lack of efficacy, I'm assuming it's related to the fact that the persons may not be taking enough of the active ingredients, or they're not drinking enough water. And then in other cases, frankly, the cranberry just won't work for that strain of bacteria that they're fighting. Now, another action which we've talked about during the skin lectures, when we're talking about actions related to the skin, is an astringent action. Oh, it looks like I'm going to just finish this sentence right here because I didn't do that. So astringent, when it comes to urinary tract, it helps to tonify the mucous membranes of the urinary tract. There we go. And where this is useful is if a patient has a urinary tract infection that has blood in the urine, some inflammation, then this astringent action will have a couple properties. One, it'll help to close up the bleeding, so it makes the mucous membranes a little bit tougher. So it may be that this astringent action may denature some of the proteins on the surface of the bacteria to prevent adherence as well. So that may be one thing. Two, if there is bleeding, it can kind of, just like you would topically, although they're not in the same concentration you'd be applying topically, but they may have a slight beneficial effect to helping heal up some of the small lesions in the urinary tract. And a lot of the herbs that we've mentioned already have an astringent action to it. Another herb used for urinary tract infections is horsetail. And this isn't a primary herb that I use. It has an astringent and a diuretic effect. It's also been used historically for enuresis, which is bedwetting with children. There's no research to support it, but and I would say that most children that suffer from bedwetting probably have a certain level of anxiety associated with it. But I would say very little harm in using this. This herb's supposed to be high in silica, and if you've ever gone camping, it grows in sort of low-lying marshy areas. And so from a doctor and a signature standpoint, if you want to help remember it, if you see it outdoors, is that because it kind of grows in swampy, sandy soil, it's used to sort of treat gravel in the urine and also swampy sort of bladder infections, whether it's bacteria and stagnant water and stuff. So one of the things, just as a side note, is if you're camping, this makes for a great scouring brush for cleaning out your pots and pans, because it has a silica in it. You can just use it, grab a handful of it and use it to sort of scrub out your pots and pans with it, and it's quite abrasive. So internally, it can be made as a tea, it can be taken as capsules. Some people believe the silica is beneficial for nails and hair. I don't know what the mechanism is, why that would be, but I sometimes use it as a secondary agent for urinary tract infections. It's not my first preferred herb, but I might include it in the formula sometimes. In particular, if I was trying to tonify the bladder for some certain patients, I might use it as well. Now, when it comes to demulcents, we've already talked about the demulcent effects in the respiratory tract, and so demulcents help to soothe an irritated mucous membrane. And you have mucous membranes in your respiratory, in your digestive, and in your urinary tract. And so sometimes when people get urinary tract infections, they find there's a lot of irritation to the mucous membranes. It can cause pain, discomfort. So one of the things that you might do is include a demulcent herb, which has a particular affinity for the urinary tract to help soothe some of that inflamed area. So you might use this for a urinary tract infection or gravel in the urinary tract. It might be also useful for someone who has some type of cystitis, like interstitial cystitis, which is harder to sort of identify what the cause of it is. One of the classic herbs you could use for this is marshmallow, which historically has an affinity for the respiratory, the gastrointestinal, and the urinary tract as well. And so this isn't a primary herb you use for urinary tract infections. It's more of like an adjunctive or like a sidekick herb that you would throw into the formula. But one of the ways that marshmallow works is it has a direct effect on the gastrointestinal tract, but it will have an indirect effect on the respiratory and urinary tract. I believe that maybe the mechanism is that because it contains glycyrrhizin, the same sort of compound found in licorice, that it might stimulate the production of prostaglandins involved with making more mucus and decreasing inflammation in those mucous membranes. So it's worth including in a formula. So if you had someone that came in with a urinary tract infection, I probably would include something like uva ursi, juniper, with maybe a little bit of marshmallow, and then tell them to drink lots of water and maybe go and buy some unsweetened cranberry juice along with it. And that's sort of how I might address it. There are capsule versions of a lot of these herbal formulas you could use as well, but you can take it as a tea or as a tincture. Now, an antilithic herb, so in Greek or Latin, lith means stone. So if you've ever studied art, a lithograph is a type of print that's etched out of stone. And so an antilithic compound relates to, it basically helps get rid of stones. And some people will develop kidney stones and gallstones. Gallstones are in the digestive tract and in the gallbladder. Kidney stones are obviously in the kidneys or in the urinary tract. And so they can be very painful, any type of stone that you have, because they can cause, they can irritate the mucous membranes and the smooth muscles in those various tracts and cause them to go into spasm. So an antilithic is something that helps to break down the stones. And some of the ways that you can break down a stone is just sort of a simple physical effect that you're having. When you take an antilithic, it might increase the production of, let's say, urine. So by having a diuretic effect and drinking more water, what you're doing is you're basically producing more solvent. So most of these things will dissolve in water, but if the water is concentrated with other solutes, other little bits of stone or oxalic acid or calcium is dissolved in the blood or the urine, and it's at a concentration that doesn't allow anything else to dissolve, then it's just natural for these to form precipitates, which then turn into stones. So you need to drink lots of water in the case of kidney and urinary stones. Now, another term, just as you know, in case you didn't know, when I'm referring to gravel in the urinary tract, it's just little small precipitates, little small stones that haven't formed, these massive 2 or 3 centimeter size stones that can be very, very painful and hard to remove. So you could use an antilithic substance for that. Chancre-piedra and Joe Pyeweed are 2 herbs that are commonly used for urinary tract infections. So this is a picture of Chancre-piedra. It's a herb that grows in Central and South America. From the Doctrine of Signatures, a way that's a helpful little mnemonic is if you look, it has these little stones that grow underneath the leaves. You can see the little seeds that people go, oh, those are like little stones that end up in the urinary tract. And so that's how people help to remember it. Now, on the right-hand side, there's a number of little packets of the Chancre-piedra herb sold in a market. I think that's in Peru that I took that. And so in, I'd say, Latin America, it's well known that Chancre-piedra is used for kidney stones, and people use it down there. There are a few different species of it, of this plant. Some of them grow in Asia as well. This particular one, I think there's potential for it. I don't have a lot of experience. I've recommended it to people. It's just very difficult to know whether the stones, if they've gone away, it's responsible for this or not. So I've used it. I've seen some improvement, and who knows if it's the extra water or that, but it's certainly something I would try doing if someone came in looking for help. But there's no real good research to back it up. But historically, it's been used. So, any questions on the urinary tract? I'm just going to pop out of this mode for a second so I can see if there's any questions. We've got about 19 people signed in, so that's good. I was worried that people would just not bother coming at all. So let's see if I've got some questions here. Anna says yes. I don't know when she said that. Hi, Anna. Anyone have any questions before we move on? I'll take one more sip of coffee. How is the sound quality and the speed of everything? Am I going at an okay rate for you guys? I'd like to have some kind of engagement from you guys. It's good. Gersharan, thank you. Sound equals good. Thank you, Anna. Okay, so I don't see any questions here. We'll go till 10:30 and then we'll take a break then. So the gastrointestinal system, I would say this is one of my favorite areas to teach, also to treat patients. I would say a lot of my practice is based on treating people with some kind of illness with their gastrointestinal tract. And I don't want to be too cheeky, but to be perfectly honest with you, medical doctors, they're not that good at teaching or treating gastrointestinal issues. So when people come in with heartburns, indigestion, some very basic stuff, constipation, I don't like the treatment options that they have. And I think herbal medicine and naturopathic medicine has a lot of great treatment options for this. And herbal medicine is one of many things that I might use. I would say we're going to talk about the herbs, but I am going to discuss what things I use in practice. So I don't always use herbal medicine. Sometimes I'll use other treatments that are just safer or more effective or less side effects, and I'll mention those as we go. But I would say with any kind of gastrointestinal disorder, I almost always rule out food sensitivity. So we, in the context of using herbal medicine, you still have to rule out food sensitivities. That's so vital, because if someone has chronic constipation, chronic indigestion, chronic heartburn, those irritable bowel syndrome, colitis, even Crohn's, food is going to have the biggest impact on those conditions. The herbs are useful to treating certain things that are going on. Most people have, it's just the food's messing up their GI tract because they're eating the wrong foods, too much of one thing or not enough of another thing. So you need to look at food. Food's the foundation. It's the first thing you look at. But at the same time, if someone comes in with chronic constipation, you still have to give them relief immediately or very quickly. Otherwise, you don't gain their confidence and they won't come back and see you. So it's really important to be able to treat people, the symptoms that they're presenting with, and then try to figure out the underlying cause. It's a bit of a cliche in naturopathic medicine, but it's true. So with the gastrointestinal tract, a lot of these actions that we use don't exist in the pharmaceutical world. And I think there's huge potential for this in practice. I would say most of the people that come into my practice have a digestive issue to some degree. The majority of them, not everyone, but the majority. And herbs are something that I often recommend. Now, one of the first actions we'll talk about, and I don't believe we've talked about this yet, is a carminative. A carminative is usually a herb, or I'd say it's always a herb that's rich in essential oils. And so those essential oils have a very specific effect on the body, that they help to promote digestion, they relieve gas and bloating. Now, the way that these carminatives work is, when we talked about the essential oils before, they have a slight irritating effect on the mucous membranes. And so what they do is they cause the capillaries to relax. They also cause smooth muscles in general to relax. And so what that does is, if somebody has, let's say, gas pains, it does two things. One, it helps to relax the smooth muscles to help to normalize peristalsis. So sometimes when people get a lot of pain, or they're constipated, or they get some kind of temporary blockage in the bowels, it can cause the bowels to go into spasm. These carminatives have this relaxing effect that also kind of has a bit of an antispasmodic effect by helping to relieve the cramping pains. And so that's one way that they work. The second way that they work is they have a relaxing effect on sphincters. And you have a number of sphincters in your gastrointestinal tract that separate, let's say, the esophagus from the stomach, or the stomach from the small intestine, or the small intestine from the large intestine. And so when you take carminatives, it helps to relax these sphincters. And the benefit of this, if someone, let's say, you ate a whole bunch of kidney beans, and regardless of who you are, kidney beans will generate gas because it contains a fiber called raffinose that we don't digest, and gut flora goes nuts on it. So if you eat a bunch of refried beans, you're probably going to get gas, and some people are really sensitive to it. And the way that the carminative can help is by consuming this after you've eaten the meal, it'll stimulate blood flow to the intestinal tract, relax the intestines to have a bit of a normalizing effect on the peristalsis, and it'll also open up the sphincters to help you pass the gas. So it has kind of a dual action. One, if you've got a lot of gas trapped in your intestines, it helps relax that sphincter so you can basically get rid of it. Also, because of the increased blood flow, you probably will reabsorb some of this gas as well. So overall, the effect is it can really help decrease the cramping. And if you have that cramping, it's hard to pass the gas. So my advice, if you feel bloated and gassy, you can drink something like peppermint tea or take a bunch of fennel and go for a little walk outside. Don't stay in the classroom. Go for a little walk outside. 5 minutes later, the movement of just sort of getting up and standing and moving around, the carminatives will just sort of help you get rid of all that gas that's trapped in you, make you feel better. So that's how the carminatives work. Now, a few examples in culture. When you look at, if you go to, for example, an Indian restaurant, and at the exit there are a number of little, I guess they're sugar-coated little anise fennel seeds at the front. Things like anise, fennel, caraway, these all belong to the family called Apiaceae family. And the Apiaceae family is rich in essential oils. So other examples would be dill, would be another example of that, fennel, anise, caraway. There are a number of herbs like angelica that are in that family as well. And so you can eat these as a seeds like they do after you have an Indian meal. You can also drink them, and certain liqueurs are rich in carminative herbs. Another family of herbs is the mint family, is rich in essential oils as well. And so peppermint is one example of something that you could drink that would have sort of this carminative action. Other herbs like lemon balm are great for that as well. Finally, ginger, for example. So if you're going back to the peppermint, after dinner mints would be related to the carminative action. So this is probably how the candies, peppermints, sort of became popular, because originally they're used as a digestive, and then they just were made to freshen the breath and just sort of make people feel better. Another example is ginger. So ginger is often used as a digestive aid as well, and because of the essential oils in it, helps to promote digestion. Now, one thing that you have to be careful with carminatives in general is that although they can help with heartburn, they can also aggravate heartburn because they relax the sphincter that separates the stomach and the esophagus, allowing for more reflux to occur. So heartburn can be caused by either something irritating the stomach or something irritating the esophagus. When it comes to carminatives, the way that they can help heartburn is that because they increase blood flow to the stomach, that helps the stomach make more mucus to protect it. It also helps stimulate digestion. It also relaxes the sphincter so that food that's sort of stagnant in the stomach can then get passed to the small intestine. So it increases digestive function and decreases how long it takes for food to leave the stomach. So one of the problems that can happen is if you overeat and things sit in the stomach for too long, then it increases pressure, and then you can get reflux. So one of the things you got to watch out for is that people that are prone to reflux, spicy food, cayenne, for example, it acts as a carminative as well. And so if you had a really spicy Indian meal that had lots of various spices in there, it probably has a lot of essential oils, ginger, fennel, things like that. And then if you had some peppermint after dinner, and then you're overate and you went and laid down, chances are, because of the effects of gravity, with just being allowing things to trickle horizontally then, and also because these carminatives will relax the sphincters, you could get reflux and get a little bit of, when you burp, you get a little bit of food coming up into the mouth or a little bit of heartburn from it. So generally speaking, it's not good to lay down after meals, especially if you've consumed something spicy or taken a lot of carminatives. So peppermint tea, it's wildly available. You can buy this anywhere. I've had, the nice thing is, for example, lots of coffee stores. You can just do most of the coffee stores in Canada. If you just do the drive-through, you could ask for a cup of peppermint tea or peppermint chamomile tea, and that can be used to help promote digestion. That someone's feeling bloated and heavy and producing a lot of gas. Um, Fennel is in the Apiaceae family, and a lot of the members in this family have the same sort of umbrella-like structure to their flowers and leaves, and it produces these little tiny seeds um, that in this sort of fashion. So our spice cupboards, most of the spices that are little seeds are going to be carminative in action because they're rich in essential oils. Now, another action related to carminative is that many of these carminatives also help with nausea and vomiting, but a specific action is an antiemetic, which helps to relieve nausea and vomiting. And this action can be used for people who, let's say they've eaten a meal and they just feel a bit nauseous after eating because their digestive function is sluggish, or it could be used for someone who's experiencing morning sickness because they're pregnant, or someone who's going through chemotherapy and one of the side effects is nausea and vomiting. And so those are the main actions for this. And there are a number of herbs that can have an antiemetic effect. And some of these are well established by research, and some of them to a lesser degree. When it comes to ginger, for example, ginger has a number of studies that show it's effective to decrease nausea with people suffering from motion sickness and also from morning sickness. The other thing that's good about it, it's been established to be safe during pregnancy. So ginger is such a great herb that you can basically just boil some of this up in a cup of water and drink it that way, and you'll get the benefits. You could also buy ginger candies that you could pop in your purse or in your travel bag. So not that I encourage people to eat a lot of sugar, but these ginger candies have a significant amount of ginger in it that you could and it's nice and portable that fashion. So you could take it that way. The way that ginger works is, one, it's rich in essential oils, but two, one of the compounds called gingerol in it, it actually has an affinity for certain serotonin receptors in your body. Now, normally serotonin is involved with mood regulation. People think of it as being the happy neurotransmitter, but it also has an important effect on the gastrointestinal tract, and you've got tons of serotonin receptors in your gut. And so in your digestive tract, stimulating serotonin receptors induces nausea and vomiting. And so when you block it using something like ginger, it acts as an antiemetic drug. And there are other prescription drugs that work by the same fashion. Now, another example is marijuana. This is something that's been established to be effective for treating nausea and also stimulating appetite. It's something that would be useful for people going through chemotherapy where they're in a little bit of pain, they're feeling nauseous, they have poor appetite, and that's where medicinal marijuana is often prescribed or recommended for it. We can't prescribe this or recommend this, but it's just good to understand that from a herbal standpoint, these taboo plants have a place in medicine, and they should be considered anyways. So the marijuana picture, that's a nice little photograph. I took that, I forget where I took that. I think I took it out in BC. In addition to the ginger, so when it comes to the ginger, you're interacting with serotonin receptors. When you're taking something like marijuana, it's interacting with cannabinoid receptors that has an antiemetic effect. Also, various species of peppermint have been shown to have a beneficial effect against nausea and vomiting as well. Now, we've talked about antiemetics. Now, I've never used an emetic deliberately, but I just want to say that an emetic herb is something that induces vomiting. And this is related a little bit to the expectorant action that we described earlier on. And if you remember, with the expectorants for something like Indian tobacco, is if you take high doses of an emetic, what it does is it stimulates the receptors in your brain that makes you vomit, and so as a result, you increase mucus production in both the gastrointestinal and the respiratory tract. And so in small amounts, by increasing all that extra mucus that would normally have a protective effect against the acid that will come spilling up. It acts as an expectorant. By increasing the mucus, it helps you cough up the phlegm that's stuck in the lungs. And if you take more of something like Indian tobacco, it acts as a full-blown emetic and will induce vomiting. And it does work. There's no doubt about it. Ipecac is the archetypal emetic herb or slash drug. You can find it in pharmacy. It's been used for a long time to induce vomiting in people who've taken some kind of drug overdose. It might also be used by indigenous people. They'll use it for food poisoning and gastrointestinal infections. One, because the ipecac has an antimicrobial effect, and two, by purging out the GI tract, it helps to get rid of the bugs that could be causing the problem. So lobelia or Indian tobacco is on the left-hand side. This has a little safer profile than the ipecac in the sense that low doses, it's pretty easy to control and use it for the respiratory tract. But if you do go high enough outside the recommended range, it will cause vomiting. Ipecac's a little less predictable. And there's a picture on the right-hand side. I took that in Central America. I think it was Costa Rica that I took that. And I have never used this plant, but you will find syrup of ipecac in most drugstores. At least it was in the past, and if it's been removed, it's been just recently that they've removed that. So those are two examples of emetics. Not something we use in practice very often, or if ever, but it's nice to know the context of how they fit into herbal medicine. Now, one of my favorite herbal actions is the bitter action, and I use these on a daily, I would say probably daily in private practice. I recommend them to people, maybe weekly at the very least. But most days, there's one of my patients is either being recommended this or is already taking it. And bitter herbs, what they do is they tonify the digestive tract and increase appetite, and they also stimulate digestive function. And what's interesting about this is that bitters, I've tried to figure out the mechanism. There's not a lot of research into bitter herbs being used to promote digestion. So one of my favorite herbs, which is gentian, or yellow gentian, it has essentially no research on it, but it's been used for hundreds of years in herbal medicine to help promote digestion. And it's found in a lot of different liquors in the LCBO and also in European various digestives and aperitifs. And so a bitter tonic, what I have found for research is that when you take something bitter, it stimulates the receptors on your tongue that then tells your body to release gastrin and cholecystokinin. Now, gastrin, what the effect it has is primarily it increases stomach acid, and cholecystokinin, what it does is it increases, it's a hormone that increases the release of pancreatic enzymes and stimulates the production and release of bile from the gallbladder. So overall, what a bitter herb does is it stimulates digestive function. If you take one orally, what you'll find is that at first you'll start to salivate, and then your stomach might start to grumble a little bit, and increases your appetite. And in general, if you're feeling like you've eaten a meal and just sort of sitting there, you just feel like you've got sluggish digestion, it's a great, these herbs are great to take. And you can find them in, when you look at bitter herbs, they're a part of our culture. So if you have a martini, or if you have a glass of absinthe, or you have a gin and tonic, tonic water, for example, contains quinine. Quinine comes from cinchona bark, which is a herb used to treat malaria, and we've already mentioned it, but it was also used as a digestive aid in small amounts. So tonic water contains a little bit of an anti-malarial drug, but in very, very small amounts. Because it's so bitter, in low amounts it's used to promote digestion, and in high amounts it's used to fight off infection and malaria and stuff. So, so we've been using these herbs for hundreds and hundreds of years. Now also, even if you weren't using it in the form of a liquor, even just in our diet, we've been consuming bitter substances since the beginning of time, frankly. when you look at most vegetables and fruit now, our palates tend to prefer things that are sweet. And from an evolutionary standpoint, sweet things mean they're rich in carbohydrates, which prevents starvation. And bitter things usually, a lot of these bitter compounds are types of phytochemicals that some of them in high amounts can be toxic. And so naturally you don't want to eat too many of these things. So we have a slight aversion for very strong bitter things because a lot of the alkaloids that are toxic or certain sesquiterpene lactones in high amounts can be toxic. So we naturally have an aversion, but we have been eating these bitter substances in our diet since the beginning of time. So if you look at, if we're running around outdoors like the monkeys we are, gathering up dandelion greens or other vegetables and fruits that grow wild, they won't be as sweet as the ones that are bred now, where they basically have tried to remove this bitter taste. Even grapefruit now, I find lots of grapefruit I've eaten, they're sweeter than an orange. They're loaded with sugar and they've removed a lot of the bitter compounds. And so I would say that most North Americans' diet are relatively void of bitter compounds. Even when it comes to coffee, most people add sugar and milk to it to mask that bitter taste. My opinion is embrace the bitter. Have as many bitter things as you can in your diet because it helps to keep your digestive tract working optimally. So I don't generally take bitter herbs regularly. I do have gentian in my cupboard, so occasionally at Thanksgiving or Christmas I might take a squirt just to promote digestion if I've overeaten. Occasionally if I'm sick or recovering from a cold, I can tell my digestion is just a little heavier, so I may take a little bit then. But typically I usually eat bitter greens like arugula, endive, which is a form of chicory, and other sort of mixed greens. Those are your digestive bitters in your diet. Other examples would be drinking your coffee black. That's going to stimulate digestion. We know that coffee, for example, has a protective effect against gallstones when it's black. And so that would be coffee in a way, it's a herb. You're drinking a decoction of coffee. So there are a number of herbs that fall into this category. Yellow gentian is one of my favorites. Wormwood we'll mention in a second in a little bit more detail is another great one. Now when it comes to heartburn, you'll notice that when you read the textbooks on bitter herbs that they'll often say caution when treating heartburn with them, or avoid treating heartburn with them. Now the funny thing is that when it comes to heartburn, because heartburn is a symptom that can be related to the stomach or the esophagus, in some cases bitters will actually make heartburn. I would say in most cases heartburn improves when you get bitter, but there are some cases where it can make it worse. The situations where it makes it better is if you were experiencing reflux, where stomach acid is spilling into the esophagus because that sphincter is too relaxed. As we mentioned before, when you take a bitter herb, it increases gastrin release, and that gastrin release has a tightening effect on the lower esophageal sphincter, which separates the stomach and the esophagus. So bitters will actually help to, one, stimulate digestion, so you break down your food better, and so that you also can digest your fats better, because fats and excess amount of food can delay emptying of the stomach, and that can basically cause more bloating and pressure that then can cause a reflux. So bitters, one, they increase digestion. Two, they will actually, gastrin is known to tighten the lower esophageal sphincter to reduce heartburn. So when you look at a lot of people come in and see you, they're eating a very bland diet, and that may be one of the reasons why they're just sluggish digestion. They're eating the wrong fats, they're overeating too much sugar, and it's causing a little bit of reflux. So this is one way that you can use bitters to treat reflux. Where it can cause harm with somebody who has heartburn is if somebody had heartburn due to H. pylori or stomach ulcer. What could happen is that normally when someone gets a stomach acid, or sorry, someone gets a stomach ulcer, their body stops producing as much acid because the acid is irritating the ulcer and causing pain, and so your body sort of turns down or reduces the amount of stomach acid. And so in that situation, if you were to take something like gentian or wormwood, in theory what it might do is or someone will suffer from gastritis due to some other reason, let's say they're taking too many NSAID drugs, anti-inflammatory drugs, then if you were to give a bitter, if the body's not making enough mucus and those mucous membranes are already irritated from a little bit of acid or from an infection, taking a bitter that stimulates stomach acid could actually aggravate the heartburn in those cases. So when it comes to reflux, it can make it better unless the person has a duodenal hiatal hernia, where part of the stomach is above the diaphragm. In those cases, it's kind of hit and miss. But generally speaking, if it's normal, simple reflux, bitters will help with that. If they have gastritis or ulcers, it might make it worse. So you have to be careful about that. Here's a photograph of yellow gentian on the left. It grows in the Alps in Italy and France, up in the mountains. This is the photograph I took in the there's a really nice botanical gardens in Montreal. It grows in about June. I have never caught it in flowers. Just about the flower, I missed it by a couple, probably about 3 or 4 days, which I'm frustrated. I've never been able to get it in flower yet. If you look on the right, here are a number of digestive bitters you can buy at the LCBO. For example, Unicum and Angostura bitters contain, I'm pretty confident, most of these are like secret recipes, but they both contain, I believe, gentian in them. Jaeger and Chartreuse and Campari and have a mixture of things. Absinthe is another digestive bitter made from wormwood. I'll probably talk about it a little bit later on as well. So lots of different ones, and I like sampling different bitters from around the world. I've already mentioned this. A bitter tonic, what's the difference? I guess it's just continuation. I've discussed everything here. Now, some books will refer to different types of bitters. There's also something called an aromatic bitter. Aromatic bitters means they have phytochemicals that have that bitter component to it, but then they're also rich in essential oils. And so essential oils, that's the aromatic component. And so you can have something that tastes bitter, and then the essential oils provide that carminative action. So bitter aromatics tend to have a little bit of both a bitter and a carminative action associated with it. Garden Angelica, which is displayed on the left there, it's commonly used in in the liquor industry as well. It also can be used for respiratory tract infections, and it's a cousin of Dong Quai, which is a herb used in Chinese medicine as an antispasmodic for female complaints. They're both different species of Angelica. This one has a greater affinity for the digestive and respiratory tract, while this is the Angelica Archangelica, while the Angelica slipping my mind. The Dong Quai has a greater affinity for the reproductive system. So wormwood and Garden Angelica, bitter and lots of essential oils. So if you think about something like eucalyptus oil or tea tree oil, if you've ever put it in your mouth, it's not bitter. It's a bit caustic, it's a bit irritating, but it's definitely not bitter. Not like black coffee or something. Another example would be a bitter pungent. Not all books use this, but ginger, for example, when you taste ginger, it doesn't have a bitter taste, it has a pungent sort of taste to it. And that pungency is more of that warming sort of action. And so ginger behaves a lot like a digestive bitter, but it has that pungent sort of quality to it that it can be used for the same reasons, but its mechanism of action might be a little bit different. Again, bitter pungents are also going to be a lot like the aromatic bitters, where you have a combination of both a bitter and a carminative action. On the left-hand side is wormwood, Artemisia absinthium. There are different varieties of wormwood out there. Artemisia annua is where you get artemisinin, the anti-malarial drug. Now, just as a quick little side note, wormwood, it was made into a liquor hundreds and hundreds of years ago, and a lot of the Impressionists drank high amounts of absinthe. And absinthe, it's usually wormwood combined with fennel or anise. So it has this black licorice-like taste and a very strong bitter taste to it as well. A great digestive bitter. The problem is that wormwood, in addition to having these bitter compounds in it, it also contains a neurotoxin. And so that has a strong stimulatory effect on the nervous system. So when you consume something like wormwood, the alcohol has a depressant effect. The thuone, which is the neurotoxin in it, has a stimulant effect. And so it kind of leaves you feeling in that drunk and alert at the same time, probably like being intoxicated and drinking lots of coffee, that sort of similar sort of effect. There are also some compounds in the worm that might cause sort of a little bit of in high amounts, some visual alterations, and kind of a lot of people who drink will have a bit of a yellow or a green glow to their vision. And so a lot of the work done by the Impressionists has been inspired by consuming lots of absinthe. And most of the artwork, if you look at it, these are people like Manet and Vincent van Gogh are known to have drunk a lot of this. So here's a painting on the right-hand side of inspired by it, and you can see at the bottom there's a bottle of absinthe that's been broken, and the guy looks a little bit messed up. You can see like wormwood's not, you know, or the absinthe, it's not a substance that I think in excess is beneficial for people. So the man who's abusing it looks a little bit messed up there. It kind of makes people a little bit crazy. Another example of the absinthe drinker on the bottom, again, a bottle of absinthe. To the left, you can see a little glass of absinthe, and it has this cloudy appearance to it, because one of the things that happens when you take absinthe and you add ice or you dilute it with water is that those essential oils that are rich in the absinthe, they're dissolved in the alcohol because they're relatively fat-soluble compounds. And when you add water, you're changing the solubility of the water or of the liquor, and it's making it less water or less fat-soluble. And as a result, a lot of those essential oils will precipitate out of solution and form this cloudy sort of appearance in the alcohol. And that's sort of one of the distinctive appearances of absinthe. Again, here the guy's, he looks a bit suspicious, wearing a funny hat. He keeps dropping his bottles on the ground. More depressed-looking people who've, you know, been drinking absinthe. You can see the cloudy precipitate. Again, some funny-looking hats there. Oops. And one last thing, Van Gogh, who did lots of great artwork, he was known to drink a lot of absinthe, and probably his abuse of absinthe was responsible for him. You probably heard the story where he basically cut off one of his ears and mailed it to his girlfriend to basically prove to her how much he loved her, you know, which is kind of romantic in a weird, twisted sort of way. But obviously he wasn't thinking clearly because he was doing too much of the absinthe. So herbally, if you were to recommend it as a tincture, we're talking about a 1/4 teaspoon of this, not a bottle of absinthe a day. So now in Canada, you can buy absinthe, but they've limited or removed the thuone, which is the neurotoxin out of it. So if you go to Eastern Europe, where the laws are a little more relaxed, you can get real absinthe there. And it's fun to try, but definitely not something you should be doing regularly. Now, when we talked about the bitters, and I'm going to finish this and we'll take our break, when it comes to the bitter action, it has a number of other actions associated with it. So if you hear that something's a bitter, it also has a sialagogue, a cholagogue, a choleretic, a stomachic, and even a mild laxative effect to it. So I'm going to go through and mention a few other actions. A sialagogue is something that stimulates salivation. Bitters will do this, but there are also certain drugs that stimulate the parasympathetic nervous system that can also have a sialagogue effect. So bitters will do it through the vagus nerve, and then other herbs that are parasympathomimetics, we'll talk about them later on, can do this through nicotinic receptors or muscarinic receptors in the body. So that's just going back to physiology and the effects. We don't use a lot of the parasympathomimetics in in herbal medicine. But one example is, if you ever notice that people, when they're smoking, they do a lot of spitting, or people that are chewing tobacco, they're doing a lot of spitting. It's because that tobacco is interacting with the nicotinic receptors and causing this increased salivation or a silagogue effect. When it comes to digestive bitters, you'll notice that if you have a little bit of gentian before you eat a meal, for example, one of the first things that happens is you start to salivate. And that's just one of the mechanisms, stimulating, helping to lubricate the digestive tract, helping to release certain enzymes in the mouth to help break down food, which is good. A stomachic is a herb that has an affinity for the stomach that typically increases appetite and helps to support digestion. So it's a bit of a vague term. Usually it's used for people if they have low stomach acid, which is also referred to as hypochlorhydria, or just poor digestive function, which can also be called dyspepsia, will have this action. So most bitter herbs will have a stomachic action. I'm not even mentioning them. So I didn't mention here yellow gentian or absinthe, Artemisia absinthium, wormwood, but they will have this stomachic action. Other things like the antiemetics, like marijuana and ginger, often they will also increase appetite and help support digestion through a different mechanism as well. So marijuana and ginger aren't true bitters, but they also have the stomachic effect. Now, two actions that sound very similar, choleretic and cholagogue. So if you think about a diuretic is something that increases the production of urine. A choleretic increases the production of bile. Now, chol is referring to cholesterol, and bile is made from cholesterol. So this is where these terms are coming from. So a choleretic increases the production of bile, while a cholagogue stimulates the contraction of the gallbladder to help with the expulsion of the bile from the gallbladder. So I remember cholagogue refers to it makes the bile go. That's how I remember it. So both of these actions are indicated for people who have just poor digestion in general, but also these are the primary actions you want to use if someone has sludge or gallstones in the gallbladder, because you're trying to increase the production of bile to flush out those stones. Now, one of the safety concerns with these is if someone had gallstones and they took a strong choleretic or cholagogue, you could cause a gallbladder attack. So you need to use this with caution, but at the same time, these are also the main actions that you use if someone does have gallstones. So you just have to be aware that the treatment could aggravate that. Here's a quick little case. I had an 83-year-old woman comes in with chronic abdominal pain. She's had it for years. Very severe pain pretty much every day, lots of bloating and gas after meals, also has some arthritis in her joints. And so I figured that she could have lactose intolerance, or she could have some kind of milk intolerance in general, whether it's mediated through an immune response, like an IgG response, or whether it's mediated because she doesn't produce the lactase enzyme. Also, because she's old, she probably just has sluggish digestion because everything just slows down and doesn't work as well. So for her, we just did a quick little elimination diet by removing the milk that she was drinking every day. And then we also recommended taking a digestive tincture that had gentian and a few other things in it. So when we removed the dairy, so we started with the diet alone. The diet had a very substantial improvement in her symptoms. So this is the scale is a 6 out of 6 is the worst, 0 out of 6 is the best. So when she came in, when we removed the dairy on the first visit and a couple other small things, we saw that our symptoms basically went from a 5 down to a 3. So not quite a 50% improvement, but a huge improvement. And so that suggests that definitely food was playing a role in that. In addition to that, what we ended up doing is giving her a tincture of gentian, which is one of my favorite digestive stimulants to take before meals. And that kind of helps to retrain your digestive tract. So with the removal of the dairy and also with the bitters, over time we basically took this chronic digestive complaint and made it so she no longer had that. And what I find with the gentian and some of the digestive bitters is you can probably, if you get them to take this on a regular basis for a few weeks or maybe a couple months, it might just retrain their digestive tract so they won't require that daily use of the herbs. So it's not something they're going to have to be on for the rest of their life, but there's no harm in doing it. And often with something like gentian, you're taking it could be anywhere between 5 and 30 drops before a meal. It's very easy for them. Like I mentioned, I don't take this regularly, but it is a great herb. If you're feeling kind of run down, stressed, and your digestion's being affected by it, or if you're, um, yeah, that's the main thing. Or if you just overeat because you had Thanksgiving or Christmas. Here's a little case study that I did. This is going back years ago. We used to have a database where we plugged in all the information of patients in the column. So these aren't all my patients. These are just a whole bunch of patients that met the criteria for dyspepsia. And dyspepsia is basically indigestion with no known cause. So there's no stomach ulcer, there's nothing else. And every single one of these patients in the study was given digestive bitters, and they may have also been given other things as well. Could be enzymes and stuff like that. So the point of this is that you can see the trend is that a lot of these patients saw some improvement when given bitters. I think the best way to help with digestion is to give digestive bitters along with removing food sensitivities. Now I'm going to take a little break right here. If you have any questions, let me know. I drank a bunch of coffee. It's having a diuretic effect, so I'm going to run off now. And take 10 minutes, and we'll be back at 10:46, okay? Okay, so I'm back. I'm going to check and see some questions here. Brennan asks, is hydroquinone also used for malaria? The name just sounded very familiar to me when you mentioned it. There's chloroquine. There's various different types of chloroquines that are malarials. Hydroquinone is not used for malaria, um, but chemically there's some overlap in the way the name sounded. Uh, Gershran said, sorry, I missed what carminatives are rich in. Carminatives are rich in essential oils. So when you look at things like peppermint, fennel, anise, they have those little volatile oils that you also get in things like eucalyptus oil or tea tree oil and things like that. Question is, in other provinces and states, can you prescribe marijuana? I cannot prescribe marijuana in any state or province, Anna. This is something that I believe only medical doctors can prescribe. If we could prescribe it, I'm sure there'd be a lot more successful naturopaths out there. Is this being recorded? Are you referring to this? I'm hoping this is recorded. It is being recorded, yes. Just to clarify, Adriana says, just to clarify, are bitters useful for heartburn if caused from eating certain... Sorry, I gotta figure out how... Why does it do that? It doesn't allow me to read the whole thing. I'm just gonna put it back. I think if I leave it on... You guys can't see what I'm doing, but if I leave it on the right-hand side there, I can see the whole thing. Just to clarify, are bitters useful for heartburn if caused from eating certain foods? And aggravate reflux if it's caused by an ulcer or hernia? I would say that bitters are useful for heartburn if caused by certain foods, like overeating, foods in general, too much fat, a poor digestive function, eating too close to bed, even with spicy food, they can be helpful to improving that. And yes, I would say that bitters have the potential to aggravate if someone has an ulcer, maybe a type of hernia, like a hiatal hernia. Not necessarily, but has the potential. I've seen it help and aggravate hiatal hernias. So a little bit of both. So those are all the questions. Moving on. Okay, moving on. There is another action called antispasmodic, also called spasmolytic. We discussed this already when we're looking at the respiratory condition. In general, antispasmodic herbs, what they do is they target smooth muscles, and when smooth muscles become irritated by something, they tend to cramp up. Usually a lot of these smooth muscles can have sort of rhythmic contractions to it. But if those rhythmic contractions become broken up, they might start to cramp up in certain areas and cause a lot of discomfort and pain. And you could have kind of spasming of these smooth muscles occurring in the lungs, because you've got smooth muscles in the trachea. So if someone has a spasmodic cough, it could have that sort of cramping like action. In the urinary tract, if you're trying to pass a kidney stone, then the ureters can cramp up because that stone's irritating that. It can also occur in the gallbladder. So if someone's passing a gallstone, then you'll get the bile ducts will cramp up, or the gallbladder itself will cramp up and cause pain. But you can also have it in your bowels. So if someone, if you eat a food sensitivity, or if you're constipated and there's stools piling up inside you and you're losing the ability to have normal peristalsis, then you can get cramping and have this spasmodic pain. Another term for spasming of smooth muscles in the digestive tract is colic. So you could have, let's say, a colicky baby, a baby that's complaining and crying a lot. That's usually because the baby or the mother is eating something that's irritating the GI tract of the infant. To give you an idea, our daughter, who's very, very healthy and happy, when my wife was breastfeeding, if she even drank, if she even had like a quarter of a tablespoon of milk in her tea and then breastfed our daughter, that small amount of milk somehow would make its way into the breast milk and irritate our daughter's GI tract, and our daughter would suddenly become constipated and colicky and just complaining and miserable for a day or two. And we tested it by removing it and then reintroducing it, and it was amazing to see how much milk affected our daughter. So I'd say that with kids that are colic, who experience colic or colicky babies, uh, colicky babies have food sensitivities. That's all it is. And you just have to identify the food sensitivities and remove it. Now, you can also give herbs. There's things like gripe water, for example, that contain a mixture of antispasmodic and carminative herbs that can be used to treat colicky babies. And you can buy this at the drugstore. And this might contain fennel or peppermint or ginger and things like that. So colic or a colicky baby usually refers to cramping and spasmodic pains in the GI tract. And when it comes to children, it usually also refers to a fussy baby. But you know what? If I was feeling constipated and have a lot of cramping pains in my GI, I'd be kind of complaining and fussy as well. Babies, it's not just the emotional component, it's the physical component, but we only are affected by the emotional side of it. In addition to colic in the gastrointestinal tract, in the intestines, you could have someone with biliary colic. So this is when someone has a gallstone that irritates them and causes cramping pain under the right rib. Or you could have renal colic. So someone's passing a stone, a kidney stone or something that's causing colic there. So different types of colic can be used. You can use antispasmodic herbs to treat that. Now, in general, I would say antispasmodic herbs, I would say all carminative herbs have some antispasmodic effect. Like they do help to normalize and relieve cramping in the smooth muscles. But in addition to that, you can have other mechanisms that can occur with this. So if you were to look at something like opium poppy, someone who was taking some kind of opiate, a very potent drug, it relieves, opiates in general will relieve pain, but they also can suppress a cough. Or if someone has severe, let's say, diarrhea, taking an opium, what it does is it shuts down the parasympathetic nervous system and basically stops the cramping pains in the GI tract. And so it was used historically if someone had severe cholera or really bad infectious diarrhea where they're losing a lot of fluids and in a lot of pain from the kind of the cramping or projectile diarrhea. Opium could be used for that because it also has a very constipating effect. Other herbs like deadly nightshade, which is what's called an anticholinergic, it suppresses the parasympathetic nervous system and can be used as an antispasmodic for biliary colic or other types of colicky pains. So generally speaking, those are pretty potent ones that we won't use those in practice, but you can use them. And there are drugs like atropine, which comes from deadly nightshade, or various opiates that are similar in structure to the ones found in the opium poppy that have been used as antispasmodics. A herb that I would say is relatively safe that can be used is a cousin of the opium poppy, and it's called greater chelidine, or also known as chelidonium. And this herb contains a yellow resin, and it has a great affinity for the liver and for things involving the gallbladder. And from a doctrinal signature standpoint, because of that yellow resin, it has an affinity for things to do with bile. And it's been used for people who have jaundice or gallstones or liver issues in the past. And its main action is it's a strong digestive bitter, but the compounds in it, which are referred to as isoquinoline alkaloids, have an antispasmodic effect. So it promotes digestion and helps to relieve cramping pains. It's used primarily for cramping pains in the GI tract, but also because women have smooth muscles in the uterus, it has, in some herbal textbooks, been used for menstrual complaints as well. And often women who have menstrual issues, usually they have maybe sluggish gallbladders and poor digestion and maybe some constipation. So greater celandine will be used as a digestive bitter, but also as an antispasmodic. It's also used in patients who have gallstones to increase bile production and release. And historically, it's also used as a blood cleanser because it can act as an alterative because it's working through the digestive tract to help break down foods and also eliminate waste products through the liver, that it can be used for chronic skin conditions. And you'll notice that a lot of herbal remedies that are used for the skin often will have an antimicrobial effect, but also have some kind of digestive bitter and work on the liver as well. So this would be, I would say this would be a herb that's stronger than things like peppermint or fennel oil that could be used for patients suffering from irritable bowel syndrome or other spasmodic sort of conditions. Now, there is some safety concerns about greater celandine. I've noticed there's a number of case reports of it causing drug-induced hepatotoxicity, so liver damage when people take it. It is reversible, but it has occurred in the literature, so it's worth noting as well. We'll talk about safety issues later on in more detail. Now, we've already mentioned the antilytic mechanism when we're referring to kidney stones. Now, when it refers to gallstones, there are a few herbs that you can use. Any kind of bitter herb in general is going to have a cholagogue and a choleretic effect. And so what that means is a substance that increases the production and release of bile will basically help to dissolve gallstones. Now, when you think about gallstones, most gallstones are made primarily from cholesterol, and some stones are also made exclusively from or mixed with cholesterol and bilirubin. So we won't worry about those ones, but the most common types are gallstones related to cholesterol. And I think a lot of the reason why people form gallstones is because they don't eat enough bitter foods in their diet, and as a result, they're not producing and releasing enough bile. And when you look at, in practice, I noticed that the majority of my patients who had gallstones didn't drink coffee, or if they did, they drank it with a lot of sugar, like a triple or something. And what's interesting, I did a little search in PubMed and discovered that coffee does have a protective effect against gallstones. And that's likely because coffee is a bitter, and it acts as a bitter herb to increase the production of bile and the release of it. And when you think about if a stone like cholesterol, the reason why people form them is that in your gallbladder, cholesterol gets bumped in there with some bile, and it's a way that eventually it'll be released in the intestinal tract to help with the absorption of other types of fats. But if it's saturated with cholesterol because you're not making enough bile, or it's kind of a sluggish gallbladder and it's not releasing it, then that cholesterol will slowly start to accumulate and become more and more concentrated in the gallbladder. And eventually, if it reaches a certain concentration, it'll just precipitate out of solution and start forming little crystals. And those crystals will eventually form little bits of gravel that will then form into stones. And so the main cause of gallstones is an underactive gallbladder. And this can occur, for example, when people are fasting, doing extreme dieting, or people with eating disorders. It can also occur when women are on have elevated estrogens, whether it's from certain types of hormone therapies or when they're pregnant, that reduced gallbladder function will cause an increase in gallstones. And the simplest solution, if you have too much of the solute, which in this case is cholesterol, you have to increase the solvent, which happens to be bile. So these bitter herbs in general will do this. One particular herb, which is an archetypal herb used for gallstones, is boldo. And boldo comes from South America, It's an antimicrobial. It's a digestive bitter. It can be used specifically for treating gallstones. I've used this with formulations combined with chelidonium to help with the biliary colic and some other herbs to dissolve gallstones. And here's a case. Uh, I think this is, I've never published this, and I really should get around to publishing it, but this is probably the only case that I've ever seen of objective evidence of herbal medicine being used to dissolve gallstones. And I had a woman who came in who had at least 3 gallstones that were roughly 1 centimeter in size. And over the span of 2 years before she came in to see us, there was 3 different ultrasounds showing that she had these gallstones. And the doctors wanted to perform surgery, but she was a relatively young woman and she didn't want to undergo the surgery. So they sort of waited to see what would happen. She'd often get cramping pains in her gallbladder. Her diet wasn't very good as well. And so what we ended up doing is I gave her a tincture that contained about 4 different herbs, digestive herbs, bitters, and antispasmodic herbs, and it also included boldo and chelidonium, as I mentioned. And she took this for roughly 1 year. It was over a year. And when they performed the ultrasound afterwards, there was no longer any gallstones. So this is really neat because you basically have 3 ultrasounds that confirm gallstones. They stayed about the same size. They can fluctuate by a little bit. That could be the stones are getting larger or smaller just a little bit depending on her digestive function, but it could also be that whoever's measuring it, it's not an absolute or a perfect science. You're trying to measure it, with a 3-dimensional object that's moving around in the abdomen a little bit, so you might be off by 5 or 10%. But in general, we're looking at about 1 centimeter in size. Treating it with herbs after 1 year, we saw a reduction. Now, I think this is a pretty cool thing. And I'm rather proud of this case report. Since this original case, I've treated a number of people with herbs with gallstones, and I can say that this is the best case where I've got really good objective evidence before and after. I've treated a number of people with gallbladder sludge, so they don't actually have a stone. They basically have a whole bunch of tiny, tiny stones under, 1 centimeter, or sorry, 1 millimeter or less probably. And I've treated it using herbs, and the gallbladder sludge has been removed. I've also used it on some other patients who have gallstones, and for the most part, either the symptoms improved or the stones got better. I know that I had at least one woman who came in also with a fatty liver, and so fatty liver disease can be caused by basically alcohol abuse, viral infections, but there's something called non-alcoholic fatty liver disease, which is basically caused by consumption of too much fructose in the diet, which then your liver can't handle and ends up producing more cholesterol as a byproduct to it and developing lots of fat in the liver. And so the woman who came in had a fatty liver disease, and she had gallstones, and we gave her the tincture and changed the diet. What we found was that the fatty liver resolved, but there was an increase in the size of the stones. And what I think probably ended up happening with all this increased fat that had accumulated in the liver, it has to pass through the gallbladder before it gets removed from the system. And so we probably supersaturated the bile, even though we were producing more of it and we were releasing more of it, it still ended up getting saturated with all the extra fat coming through the liver. So we saw an increase in the stones. And then I think the patient became discouraged and decided never to come back or decided to discontinue the treatment. So I've had at least one negative study where the stones got better from the treatment, but we had an associated fatty liver, so a couple things going on there. And another case where we had a woman who had splenomegaly. She had she had a blood disorder, I believe it was thalassemia, where when the blood gets broken down because of some sort of disorder with the shape of the cells, the spleen ends up breaking them down and releasing more bilirubin. And in addition to cholesterol stones, you can have bilirubin stones. And if you have bilirubin stones, they could, in theory, be broken down by this. But what we found was when we gave the tinctures, it actually precipitated an acute gallbladder attack. where one of the smaller stones went inside the common bile duct, and the woman had to be rushed to the hospital. So when you're treating gallstones, one of the big risks that can occur is that you could precipitate a gallbladder attack. And if a gallbladder stone or if a gallstone ends up getting stuck in the common bile duct, it can become an emergency situation because the enzymes that come from the pancreas could end up getting blocked in there and causing basically auto-digestion of the pancreas. So there are risks, but there's also risks with surgery. In Europe, they tend to do more of a wait and see what happens if people have gallstones, while in North America, they have the tendency just to rip out the gallbladder, and just because they claim there's no side effects or basically very little risk associated with removing the gallbladder. But I can tell you that in practice, I would say almost all, or at least the majority of women who come in, and women have the gallbladders removed more than men do. The majority of women who've had their gallbladders removed tend to have some fat intolerance. They don't digest fats properly because they no longer have a gallbladder. And so rather than getting a big spike of bile with each meal, which is what the gallbladder does, is it helps to give you that little bit of a spike of bile to help with the fat absorption. If you don't have a gallbladder, you're just going to have basically bile trickling out of your liver all day long, which can cause a little bit of diarrhea and also decreases your ability to digest fat. So that's gallstones. Now, another action what we'll talk about is hepatic. HEPA refers to like liver or filter. Basically your filter of your body is your liver. Think about HEPA filters and things like that. Other names for this. So hepatic herb basically is something that has an affinity for the liver to make it function better. So this is a very vague term. Generally speaking, it improves liver function, and that could help with detoxification. It could help with digestion. There's a lot of, in the old herbal textbooks, people who have hepatic torpor, this refers to a lazy liver. And so what that means is you're just not eliminating and processing the various waste products in the body as efficiently as possible. So giving someone a hepatic herb will help to maybe protect the liver, help with detoxification, just make everything work optimally. Milk thistle is the archetypal herb used for sort of as a hepatic herb. It has a hepatoprotective effect. It helps with detox and a number of other things. It's a very safe herb. Another action we'll talk about is a hepatoprotective. So what this means is there are certain phytochemicals that enter into the liver, and they basically help to protect the liver against poisons or toxins that may come from the diet, or could be drugs that the person's taking. And so in general, you'd use this for detoxification, or for people who have hepatitis, or if they're taking drugs that are toxic to the liver, like Tylenol, or certain types of mushroom poisoning, or alcoholics. There are lots of different herbs that have a hepatoprotective effect. Milk thistle and turmeric are two classic examples of herbs that have that affinity for the liver. And maybe some of the ways that milk thistle works, as I mentioned before, it's hepatic, so that's just sort of a vague sort of thing. But we know by looking at some of the research on milk thistle and its active ingredients is that it appears to stimulate RNA polymerase I activity, which helps to increase protein synthesis in the liver to help with liver regeneration. So I think most people probably know that your liver is one of the organs in your body that can actually regenerate. If you remove a portion of it, it'll grow back in. And so milk thistle might help to stimulate that. If there's any kind of damage to the liver, it helps with the recovery of it. Also, because milk thistle contains lots of different antioxidants, these antioxidants sort of go in and mix in with the hepatocytes, the cells of the liver, and kind of help to shield them against free radical damage. Also, glutathione is an important antioxidant that is made from 3 amino acids, including cysteine, that is used as a phase 2 conjugate in the liver. So glutathione is really important, one, for protecting you against free radicals, 2, to help with liver detoxification. and so it appears that milk thistle upregulates that process in the body. Another thing is that the antioxidants that milk thistle contains, they sort of interact with the hepatocytes and help to shield them not just from free radicals but also from other environmental toxins and drugs that might try to bind or interact with the cells. So it has a protective effect with that. And finally, just as an interesting little note, is that milk thistle contains flavonoids that basically help inhibit beta-glucuronidase. And beta-glucuronidase is an enzyme that removes sugar from various chemicals in the body. So one of the things that your body does, for example, is it attaches a sugar onto estrogen to make it more water soluble. And the beta-glucuronidase enzyme, a lot of bacteria that in your gut basically have this enzyme, and so bacteria are able to cleave the sugar off of estrogen, and then what happens to the estrogen is reabsorbed and it can become elevated in the system and cause drastic elevations and drops in estrogen that can cause severe menstrual cramps or migraines and things like that. So indirectly, milk thistle works on the liver to help with the help metabolize various toxins and also probably things like estrogen, but also helps to work on the gut to indirectly help clear estrogen from the body. And that's one of the reasons why things like liver herbs and milk thistle and things are often used with women who have menstrual disorders. Now, we've already discussed anti-ulcer or anti-ulcerogenic herbs when we were talking about topical skin conditions, but there's a few different ones that we also use in the intestinal tract. So your main indication for the anti-ulcer herbs or anti-ulcerogenic herbs would be for stomach ulcers or duodenal ulcers. You can also use them, some of these could be used topically as well for leg ulcers or skin ulcers. The archetypal or the best probably anti-ulcer herbs used is licorice. And as I mentioned before, licorice is a great herb used for ulcers. It inhibits one of the enzymes that's involved, or it stimulates one of the enzymes involved with making prostaglandins to increase mucus production in the intestinal tract. So things like NSAIDs, drugs that inhibit cyclooxygenase 1, the enzyme, they basically have as a side effect an increase in gastritis, which is inflammation of the stomach, that if it gets bad enough turns into a stomach ulcer. So licorice can counteract the side effects of those drugs. Licorice also has some antimicrobial effects against certain bacteria and viruses that could cause stomach ulcers, including H. pylori. So that's how licorice has an anti-ulcer effect. Meadowsweet we'll talk about momentarily, but it has an antacid effect, and it's often used for people with stomach ulcers. And the third herb, which is great, is German chamomile. Now, it has a different mechanism than the licorice and the meadowsweet. German chamomile can be used both internally and externally as a vulnerary. And so what it does is it helps to decrease inflammation of the stomach and also helps to speed up the healing of ulcers. So German chamomile is an amazing herb for stomach ulcers. And I would say one of the things that I often will get people, if they have any kind of gastritis or stomach ulcers, is just encourage them to drink as much chamomile tea as possible throughout the day. They could combine it with peppermint as well. Peppermint also has some anti-ulcer effects as well, because the essential oils help to increase blood flow to the intestinal tract, and that can also help produce more mucus and decrease ulcers. So German chamomile, it works primarily as a vulnerary. Meadowsweet works primarily as an antacid, and licorice, I would say, works primarily as a demulcent. So there are three different herbs with three different anti-ulcerogenic effects. There's meadowsweet growing on the left, chamomile growing on the right. Now, typically, medical doctors usually use acid-blocking medications to treat stomach ulcers and heartburn. One of the issues that I have for this is most people who develop heartburn, it's not because they produce too much stomach acid. It's not an issue with acidity. It's not. If you think about your stomach, you are supposed to have a pH of about 1 or 2 in your stomach because you need to break down protein. So we have stomach acid for a purpose. When people get heartburn, it's not because they're making too much stomach acid. The problem is that the stomach acid is going where it's not supposed to be going. And that's either into the esophagus because the lower esophageal sphincter isn't keeping it contained within the stomach, and that can cause heartburn, or someone's not making enough mucus in their stomach, and so you need that protective barrier to protect you against the stomach acid, because the cells of the stomach are vulnerable to it if they don't have the mucus. So when it comes to heartburn, it's not that you have too much stomach acid, it's that the acid's going in the wrong place. So I generally don't think that using an acid-blocking medication is the best approach to treating these things. Now, there is some exceptions. If someone has a stomach ulcer where it may have started off that there's some sort of irritation to the stomach and now it's not healing, it's good to sometimes suppress stomach acid for a short period of time just to give the body enough time to heal up and produce more mucus and get rid of the ulcer or the irritation. And so there is a place for acid blocking drugs or acid blocking herbs. Now, what's interesting with meadowsweet, it's been used historically for heartburn and to suppress stomach acid. And there are different mechanisms that you can have. Often what happens is histamine generally is used to stimulate stomach acid, and so certain drugs are H2 blockers, or certain classes of antihistamine unrelated to the allergies. Histamine is involved with both seasonal allergies and stomach acid production. So acid blocking drugs could be H2 blockers, which can be available over the counter. You might also get a prescription proton pump inhibitor, which acts at the cellular level, where it basically inhibits the production of and the pumping action of all the stomach acid, the protons, the H plus ions into the stomach, lumen of the stomach. Now, meadowsweet isn't as strong as the proton pump inhibitors and the H2 blockers. It works further upstream, where it basically inhibits histidine decarboxylase, and this is the enzyme that's responsible for manufacturing histamine from histidine. Histidine is the amino acid, and so it has a relatively gentle antacid effect. So I've used it before. It works pretty good. I'm not opposed to using some of these acid blocking drugs for short periods of time, but I don't recommend them in general for long-term use. When you start suppressing stomach acid, you're going to have issues breaking down proteins and unraveling the proteins. You also could potentially decrease one of your body's first defenses against infections of the gastrointestinal tract, because stomach acid basically helps to kill viruses, bacteria, and parasites as well. So if it's not working, there is research that shows you're increasing your risk for getting infectious diarrhea or vaginal or yeast infections in the gut and a few other things. So antacids, you want to use this more for to acutely give symptomatic relief and try to heal up the ulcers and gastritis. As I mentioned already, vulneraries are used to speed up the healing of wounds. So if someone had a stomach ulcer, you would want to use a herb like chamomile. Chamomile is a fantastic herb. It's safe with children. So if the kid's got a tummy ache, you can give them chamomile. It has a carminative and a vulnerary effect. So if there's any irritation, it can help speed that up. It also has a carminative action to help with gas and bloating and colic. And it has some antispasmodic effects that are related to the flavonoids, not just the essential oils that can help. So it does help with lots of different things. Also, if there are some canker sores in the mouth, you could do like a gargle or a rinse with chamomile. It can help with that. My nephew recently got braces on, and as a result, his mouth was really irritated just because it hadn't developed a tolerance to having all this sharp metal in his mouth, and so he had a lot of inflammation and irritation and pain in his mouth. And so I just told him to basically rinse with chamomile tea, swish it around, and keep it in his mouth for throughout the day as much as possible, and it really sped up the healing. And overnight, instantly, it really went down, the swelling and inflammation that he had. So it works like a charm, and it's safe, and it tastes pretty good. Our daughter, sometimes if she has a bit of a tummy ache, we'll just put it in her bottle and she'll drink it. She's been doing that since she's been 3 months old. So, so some kids like it. It's a bit bitter, but that's okay. Now, another action that we've already talked about is astringent. So astringent actions, we apply topically to stop bleeding. Internally, you can use it for similar mechanisms. What it does in the astringent action is it'll tighten up the mucous membranes and thicken them up so it makes it less permeable. Now, when it comes to intestinal issues, if you had some kind of ulcer or damage to the mucous membranes and you needed to sort of thicken that up so that it became more resilient to stuff, then you'd use some kind of astringent agent. So if someone had a stomach ulcer that wasn't healing and it was bleeding, if you took a bunch of astringent herbs, it would help to tonify that mucous membranes, tighten it up a little bit, and create a protective barrier so that it was less susceptible to the stomach acid. Or if someone had like infectious diarrhea, you could use an astringent agent, and it worked by two things, a couple different mechanisms. One, that astringent action will literally tan the bowel and make it less permeable to water. That's one way that it'll have an effect on that. The second thing is that a lot of the exotoxins that are produced by bacteria and parasites that cause infectious diarrhea, they're protein-based. And so, as we mentioned before, astringent things interact with protein. So if you have your oaky red wine with a steak, the tannins, the astringent compounds in the oak will bind up the meat proteins, and as a result, it won't have as much of an irritating effect on your gut. So if you were to take something that was very, very astringent, although it can be a little irritating to the mucous membranes and maybe cause a little bit of cramping pains, it'll also bind up those exotoxins. At least this is what I think might happen, and prevent those exotoxins from adhering to the mucous membranes and stimulating the influx of sodium ions into the bowel that causes the diarrhea. And then the third thing is they could potentially bind directly to the bacteria and the other organisms that cause the diarrhea to prevent them from adhering to the bowel walls and the mucous membranes. So, in summary, it can help speed up the healing of ulcers. If there's any kind of bloody diarrhea, it can help with that by tanning the bowel walls to decrease the loss of water and also prevent the adherence of exotoxins from bacteria to the bowel walls. So one traditional medicine that's often used in the tropics is if you have traveler's diarrhea, you might eat green bananas, because green bananas are high in astringent compounds that can have a tanning effect on the bowels and help with that. You could also use herbs like witch hazel and oak that we've used topically. These could be indicated. There are other herbs that are often recommended internally for various types of diarrhea, including it's slipping my mind, sorry. It's not in front of me right now. It's not a herb I use very often, and it's almost on my tongue. It's just not quite there. Anyways, there's a whole bunch of different herbs that you could use internally. The dragon's blood that I described earlier on for the leg ulcers, I showed you a little picture of that. It's been used historically for traveler's diarrhea in the tropics in Central and South America. It's also got a lot of research for that as well. So witch hazel and oak are the archetypal herbs used for that. They're not the main ones that I use, but you can use those. One of the concerns with using astringent compounds long term is they can tan the bowel walls, and that could affect the absorption of certain nutrients, and they can also bind up with some minerals and also some medications and prevent them from being absorbed as well. So that would be one thing. The other thing with astringent things, remember, if you drink a lot of oaky red wine on an empty stomach, it can cause a bit of a stomach pain. So taking high amounts of astringent compounds does irritate the mucous membranes and cause a little bit of cramping pains. Now, we've mentioned demulcents when we're talking about the respiratory tract. Demulcents are used to stimulate, well, they protect the mucous membranes that are irritated and inflamed. And so the way that demulcents can do this is it can have a direct effect by, if you take herbs like slippery elm and marshmallow and add them to water, what will happen is the fibers in that, you'll see they'll start to become viscous and they'll start absorbing water and becoming like a kind of like a slimy water. And if you add enough of them to the solution, sometimes they'll gel up and form like a semi-solid gel. And so the fiber itself acts as mucilage. Mucilage is like plant mucus. So we make mucus and plants make mucilage, and they both create this sort of slippery, slimy consistency that can be used to store and absorb water to have a protective effect. And so when you drink something like slippery elm or marshmallow or oatmeal or other foods that are high in fiber, that slimy consistency, it kind of coats your mucous membranes in your esophagus and protects it. So the demulcent action when it comes to herbs that are high in fiber is also related to certain bulk laxatives, because a lot of laxatives have a lot of fiber in it as well. So in some cases, demulcents and bulk laxatives can have a similar mechanism. Another thing that can happen is that with licorice, for example, there's no fiber in licorice, or not a significant amount of fibers that causes the demulcent action. Rather, as we mentioned before, the phytochemical in it, the glycyrrhizin, it actually stimulates the production of prostaglandins that are responsible for making more mucus in the body. So licorice, rather than supplementing with quote-unquote mucus, it's used to stimulate the body's own mucus production. And that's why licorice can also be used in the respiratory and the urinary tract as well. I believe slippery elm is primarily used as a form of mucilage, as a fiber, and it doesn't really have the same affinity on the urinary and the respiratory tract. Well, marshmallow, although it does contain some fiber, and it does form a little bit of mucilage when you add it to water, I've found some studies that show it also contains glycyrrhizin, the same active ingredient, licorice, to a lesser degree. So you may have kind of the dual action of both has some mucilage, and it also stimulates the body to make its own mucus. So demulcent herbs are great. When you use demulcent herbs for various GI conditions, you use it whenever there's a condition that has like an itis. So itis basically means inflammation. So if you have gastritis or esophagitis or colitis, that just basically refers to inflammation of the corresponding organ. And so demulcents, often what I'll do is I'll recommend people take slippery elm or marshmallow in a powder form, or I might say add a, for example, I had a patient who came in, she had for a number of reasons, she recently developed a whole bunch of pain and bowel, the bowels became inflamed and painful. And so one of the things that I got her to do was I gave her a bag of slippery elm that she would take half a teaspoon or a teaspoon, add it to about a liter of water, a bottle of water, and then I get her to add a teaspoon of licorice tincture in with it, and then she'd shake that whole mixture up, and it would thicken up a bit to kind of like a slimy water consistency, and she would drink that. And as a result, the licorice helped her body make her own mucus, and then the slippery elm had this own mucilage that protected the mucous membranes, and it gave her a lot of symptomatic relief that she could drink throughout the day and she'd also be drinking some chamomile tea as well and some other things to help just heal everything. So as an aside, we also recommend a lot of probiotics to people. Again, you got to work on the diet. So lots of different things that you do, but these herbs are very useful. One of the things with demulcents, more so with the demulcents that are high in fiber and also with bulk laxatives, is that anything that's rich in fiber, it has the potential to slow and reduce the absorption of nutrients in medications. So it may or may not be a real concern, but just be aware of if you take a lot of fiber with a drug, it will slow down the absorption. So marshmallow is shown on the left-hand side. This is the plant that was originally used to make the confectionery dessert marshmallow. So this herb, which produces, when you add it to water, it makes kind of slimy stuff. So sugar and the fiber from this herb would be combined to make desserts with it. Now, the marshmallows you buy at the grocery store now that you roast over a campfire does not contain this herb anymore. It's just made with various types of sugars and starches and stuff. On the right-hand side, this is slippery elm. Slippery elm is a great herb that uses the inner bark of the plant. It's quite a bit more expensive than marshmallow. Marshmallow root, I often use it. I prefer using it in a lot of ways because it's easy to grow and cultivate. And compare that to slippery elm. One of these slippery elm is that Dutch elm disease went through North America. I don't know how many years ago now. So there's not as many elm trees growing, and so I think you can responsibly harvest slippery elm, but it's much easier to meet the demand using something like marshmallow leaf and roots than it is using slippery elm. The other thing is that slippery elm is usually about twice the cost of marshmallow. Just as an aside, when I buy these, you can buy about a pound of marshmallow root maybe for about $10, and you can buy about a pound of slippery elm for about $20 or $25. And so you get a brick of this stuff, and then we usually divide it into little bags for our patients and sell it for $5 or $6 per bag, which is very cost effective for the patients. Compare that to, let's say, $30 if you were to buy it encapsulated, or even some people will encapsulate these for the equivalent would be maybe $50 or $60 for a standardized extract of slippery elm. So it's very expensive if you're buying it in capsule forms, but you can easily just take a spoonful of this and add it to water, and it's great that way. A brick of, or like a pound of slippery elm, like you could probably literally throw this into a small swimming pool and it would turn the whole pool into jello. So it's very, very concentrated, and that's only about $10 or $20. Compare that if you were to buy a tincture of slippery elm. You don't need to use fiber, or you don't need to dissolve fiber with alcohol. You just use water. And so if you were to buy a tincture, it would probably cost you the same amount, but you'd only be using like a couple tablespoons in it, and you're more likely to get drunk before you get the health benefits from the slippery elm. So I generally don't use slippery elm in tinctures. Marshmallow I do, because it does have both a direct and an indirect effect on the mucous membranes. And so sometimes a little bit of marshmallow in a tincture will kind of make it a little bit slimy and a little bit soothing going down. But for something like heartburn, I'd be more inclined to go with the powdered version of these instead. And I've already mentioned the mechanism of action for licorice, that it basically inhibits the breakdown of prostaglandin E2 and PGF2 alpha, which are involved in making mucus in the body. Now, another action that's associated with fiber are bulk laxatives. And so bulk laxatives, or a bulking agent, basically helps promote bowel movements by stimulating peristalsis. And the way these guys work is when you take fiber, let's say oatmeal, one of the things that happens is it expands. Have you ever seen those little, in those gumball machines, you buy those little lizards that are about this big, and you drop them in water and you leave them overnight, and you wake up in the morning, they've like increased by 50 times the size, the original size, little toys for kids. Those are basically made from fiber. And so what fiber does is when it's dried, it basically can absorb water. Water will it'll expand and absorb water like a sponge. And that's a good thing. One of the things with fiber in your gut is that it's not absorbed. So when you take a lot of fiber internally in your diet, it'll expand when it comes in contact with water and act as a bulking agent and sort of help to fill up the inside of your bowels. Now, when it expands in your bowels have stretch receptors that basically pick up on the presence of bulk in the stool, and that stimulates peristalsis to get things moving along. So eating foods that are rich in fiber helps to maintain regularity in general. Now, I would say that if you look at from an evolutionary standpoint, when we were monkeys running around outdoors eating stuff, we were probably eating a lot more fiber. And some people theorize or speculate that we may have been eating, let's say, upwards of 80 to 100 grams of fiber per day. Now, the average North American probably is lucky to get a few grams a day. If you're eating a Big Mac and fries, there's very little fiber, except for maybe in the sesame seeds have some in there, but you're only eating about 10 of them. So, and the lettuce might have a little bit of fiber, but it's like iceberg lettuce isn't great source of fiber. So a lot of people in North America have one, suffer from sluggish bowels. Two, they also tend to have blood sugar issues, and we know that fiber also kind of help balance your blood sugar. One of the ways that it does this is when you add fiber to water, it forms a gel. And imagine if you were in a swimming pool, if you replace the water with, let's say, Jello, which is a type of bulk laxative in a way. Don't recommend Jello to your patients for constipation, but if you had a swimming pool full of Jello when you were swimming in it, you would move much slower. And so what that means is if your bowel was full of fiber, sugar in your diet would be absorbed much slower because it's moving through the lumen of the bowels at a slower rate. And as a result of that, you're going to decrease the spikes of blood sugar and decrease the release of insulin, or at least the spikes of insulin. And that can help with weight loss and also help with diabetes prevention and some other, and also cholesterol synthesis and some other things. So bulk laxatives, or just fiber in general, helps promote regularity. It also helps balance blood sugar, can help with weight loss, may bind up cholesterol and some toxins to help move it out of the system. So in general, we should be eating much more fiber in our diet. Now, one thing I like to say is that when it comes to bulk laxatives, is these are great to maintain regularity. And what I mean by that is if someone's acutely constipated, you don't want to go, if you haven't had a bowel movement for 2 or 3 days, the last thing you want to do is take a whole bunch of fiber in the form of psyllium or ground flax, Metamucil, what other type of fiber or supplements you can think of. Because what happens is when you eat that, all that fiber, your stool is probably, the stool that's trapped in you right now is all hard and sort of blocking the exit of everything. And if you go and take a big bolus of fiber, it'll go into your bowels and it'll start to expand and try to push things out that aren't ready to be pushed. And it's going to mess up your peristalsis, cause a lot of cramping. You're going to feel bloated. Your gut flora are going to start to ferment all that fiber, and you're going to feel much worse taking the bulk laxative if you're acutely constipated for a couple of days. So what I typically recommend is take a stimulating laxative or an osmotic laxative to get the bowels working, and then use the bulk laxatives to maintain regularity, to prevent constipation, or to treat a very sluggish bowel, but not to treat acutely constipated people, if that makes sense to you. So the fiber is going to make the bowels more malleable. It's going to help store water in there. It's going to stimulate peristalsis. Lots of good stuff in there. Typically, I usually get people that eat ground flax on a daily basis. I recommend both. One of my breakfasts I get most of my patients, if not all of them, to eat is about a cup of berries with ground flax, ground chia, and hemp nut with some walnuts on top. And it's really rich in fiber. And that pretty much everyone says, oh, yeah, I love that breakfast. And my bowels, they've never been so good in all my life, because it helps. That amount of fiber in the flax and the chia really helps to stimulate the bowel movements on a regular basis and maintain regularity. So that's good. Just as a side note, if someone has chronic constipation and they seem to be drinking enough water, which is important for constipation, and they're getting enough fiber in their diet, and they're exercising enough, and they're not taking any drugs that could be suppressing their bowel movements, then you want to make sure that you rule out food sensitivities. I find that a lot of people come in with sluggish bowels, or they have symptoms of irritable bowel syndrome, or it may alternate between constipation and diarrhea. Typically, you have to remove food sensitivities. Dairy, milk, if people are drinking milk, that's a classic food intolerance, like the number one. Eggs are common as well, also some grains and stuff. So remove your food sensitivities, improve the hydration of the bowel, drink more water, for example. Also consider taking a osmotic laxative. I'll talk about that briefly afterwards. Um, Increase the fiber. Those are all good things to improve bowel health. And I usually recommend a probiotic. So pretty much everyone I would recommend should take a probiotic. It's one of the few supplements. I'd rather have people take that over a multivitamin, frankly. So that's bulk laxative. Psyllium husk shown on the left-hand side. Those little seeds on the psyllium, they can be used to maintain regularity. So Metamucil, for example, is made with psyllium husk. I've used it also for when I had infectious diarrhea in India. I got giardia. I was probably going to the washroom 10, 15 times a night. And what was recommended by one of the locals was taking isabgol, which is a type of psyllium husk, and you add it to water and you drink it. And what it does is it, just like as we were describing with the bulk laxative, it absorbs water and expands. And when it comes to diarrhea, why that's beneficial is that you've turned the water in your bowels into a jello. And so that you now have, it's much easier to control jello than water. And so in your bowels, taking a lot of bulk laxatives, ironically, can actually be used to treat infectious diarrhea because it absorbs the water and it slows down the movement of the intestinal contents because it turns it more into a gel. And so it can reduce dehydration and also give you a little bit better bowel control. So if you've ever had really bad infectious diarrhea and you're going to the washroom every like 15 minutes and you're just squirting a little bit out, or sometimes you're losing bowel control, reducing it from 25 times a day down to 10 times a day can really help make you feel better and also save you a lot of trips to the washroom. So psyllium's good. The one bad thing about psyllium is there's been a number of case reports of people adding the psyllium husk to water, mixing it up, and then drinking it. And then what happens is they don't add enough water or they drink it too soon. That fiber will start to expand and they get it stuck in the throat. It can cause a blockage if they don't add enough water. So the FDA doesn't consider it to be a safe thing for people to consume for regularity when it's the seed husks. If it's ground up or encapsulated, it's okay. It's just the concern is if you take high amounts of this and just chug it back like I was doing when I had giardia, they don't recommend that because it can form a blockage in the esophagus. So there are case reports of that, so be aware of that. Ground flax, that's the flour on the right-hand side. I use this and recommend this to almost all my patients. In addition to being rich in fiber, it has lots of omega-3s in it, and it also contains some phytochemicals called lignans that help to balance both male and female hormones and prevent prostate cancer and breast cancer, or help to prevent them, and also has some great antioxidants to help with cholesterol and preventing heart disease. So a bulk laxative should be used primarily to maintain regularity. A stimulating laxative is used to, it's basically to promote a bowel movement. And what you do with this is you typically take a herb like senna, is a classic stimulating laxative. You can find this like Senecot. Also aloe vera, the inner resin of the plant, not the gel, but the inner resin contains these compounds called anthraquinone glycosides. Same things in senna, and they basically help stimulate bowel movements, and they cause an increase in the influx of water in the lumen of the bowel and stimulate peristalsis, and that's what gets the bowels working. Castor oil, on the other hand, it too is a stimulating laxative, but what it does is it irritates the intestines, and it works in about 3 to 5 hours because it starts irritating the bowels as soon as it comes in contact with the small intestines. Well, senna usually doesn't become activated until it hits the large intestines. And so it typically takes about 6 or 8 hours before it really starts to work. There's senna shown on the left and castor oil on the right. So both of these can be purchased at pharmacies. I don't recommend castor oil internally. Like, it's kind of my last resort. The only reason why I might consider it is someone took some kind of poison or toxin or overdose and you're trying to completely flush out the system. I would take a whole bunch of castor oil because it will just basically evacuate all the bowels, both the small and the large intestines, which I don't think is a good idea if you've got chronic or acute constipation. Senna will work on the large intestines. It does work. It can cause some cramping. There are some side effects associated with it. Both of them, the anthraquinone glycosides that you find in Senna and some other stimulating laxatives, what they do is this compound migrates all the way to the large intestine, and it too has a sugar attached to it that your gut bacteria remove and activate that anthraquinone. And as a result, the anthraquinone interacts with receptors on the bowel wall, causing an increased influx of sodium into the bowel, which will pull more water in with it, and then will also irritate it a bit and cause peristalsis. So it works. There is a few side effects worth mentioning with these. One, the anthraquinone glycosides have a red to brown like color to it, so it can basically cause discoloration of the urine. So someone might get freaked out and think they have blood in the urine, but it's just this compound that some of it will get excreted in the urine. Because it's messing around with their sodium levels and salt levels, it can cause hypokalemia, which is basically low potassium levels in the blood. Most people that won't be an issue, but if someone was on blood pressure or heart medication, that could be disruptive and cause some issues. The other unusual thing is that it can cause melanosis. Melanosis is basically it causes staining or pigmentation of the bowels. So I don't really care what my bowels look like on the inside. No one's typically looking at them. But if you were to go in for colonoscopy and you were taking a stimulating laxative and abusing it, eating disorder, uh, if you take a really high dose, just because it's really hard and it's having problems being squeezed by the intestines, or if you take a high enough dose of the stimulating laxatives and everything starts contracting too quickly and the rhythm sort of gets off, it'll cause cramping pains. And so it's sometimes beneficial to take a carminative as an adjunctive herb when you start getting the cramping pain. So taking some peppermint or fennel along with it's nice. The big issue with these stimulating laxatives is that short term for a day or two, they're okay to take. But after about 10 days to 2 weeks, you're going to develop a dependence on it, meaning you're going to have troubles going to the washroom without using it. So I typically don't really use these very often. I just like to say, rather than using Senna, I would be much more inclined to use something like magnesium citrate, which acts as an osmotic laxative. Magnesium citrate is very safe to give in anywhere from a few hundred milligrams just to help pull a little bit of water into the bowel. And it, just to put it, just to give you an idea of how safe it is, they will often give 10,000 milligrams to patients before they go in for a colonoscopy to completely evacuate the bowels. Now, you'll feel pretty violated if you take a dose like that because there's a lot of cramping, a lot of gas with it. It also can cause some low blood pressure. So that's at 10,000 milligrams. Usually I'm recommending about 200 to 400 milligrams where it's very safe and just very gentle on the system. That's my go-to for acute constipation, is using magnesium citrate. And then to retrain the bowels, I'll use probiotics and add a little bit of fiber to their diet. I usually don't supplement with fiber, but usually try to work more with the diet. So I think good timing. It's 11:50, so I'm going to check and see if I have any questions. And that's kind of a connection with all the various actions in the body. You can go through that. That might help you or not, I don't know, but that's sort of the way that my brain organizes all these different actions and how they can be used in the body. What we're going to do next time, so that slide you have to delete. For the midterm, we're going to do the nervous system, I believe. I'm gonna have to check and see what all we're gonna. I forget what I covered on the midterm, but we're definitely going to have the nervous system, and I can't remember if the cardiovascular system will be on it or not. Reproduction will not be because we won't get there. So I think the nervous system will be on it, and what I'm going to try to do next week is we'll have a little exam review at the end of the lecture. and I'll give you a bunch of sample exam questions, and that'll be recorded. So if you get kicked out of the class, if someone else is used in the class, you can always watch the recording later on, okay? So I'm going to go through a few questions before you go. If you can't stay, that's fine, but I will go through these questions now for you. Does consuming coffee with sugar and milk negate the positive effects of the bitter action? Would you ever recommend clients to drink black coffee? I believe, first of all, if you're drinking coffee with sugar and milk, the sugar is just bad for you. You want to remove any unnecessary use of sugar in your diet. So train your palate to like bitter things. I love bitter things. Eat bittersweet chocolate, drink your coffee black, and then that way any other things like fruits that you eat will taste even sweeter. So the question is, will the bitter action be negatively affected if you add sugar to it? I would say that yes, it probably is going to decrease the effects of the bitter, because bitter and sweet are opposing actions. And so if you suppress the bitter taste by taking too much sugar, I think you're kind of counteracting the effects. I could be wrong with that, but I think it's just best to, like, even if you look at a lot of the bitter liqueurs out there, often they'll add sugar to it, so you get a kind of a bittersweet sort of effect. Even if it's predominantly bitter, the sugar is unnecessary and will slightly block it. The more sugar you add, the less of a bitter action you're going to have with it. So a coffee with one sugar, it'll still have a bitter action to it and promote digestion. A triple, I don't know if you're going to have any good digestive benefits from that. Not to mention all that sugar is going to get into your bowels, feed all the gut bacteria, and they're going to ferment it and go to town with it. Ju Young asked me, how likely would gallstone precipitation in the duct happen under tincture treatment? My previous co-worker had a gallbladder surgery because she was afraid of the precipitation via tincture. I would say that if you're, what happens is the risk of getting a gallstone. So a gallstone is about 1 centimeter in size, and I think the common bile duct is about 0.3 centimeter diameter. And so a 1 centimeter stone is not going to get into the bile duct. But once it becomes shrunken down, so it's maybe 0.3 centimeters, give or take a few, 0.3 millimeters, give or take a little bit, then if for some reason you really contracted the gallbladder really hard, you could push that stone into the common bile duct. Now, that can also happen if you went, for example, and ate a Big Mac and a bunch of fries, or just had too much oil in general. So I don't know how likely it is that it can happen. I've treated lots of people with tinctures, and I've only had one person have a gallbladder attack. And they could have had the gallbladder attack if they didn't take the tincture as well. So it is a risk, but again, there is risks. I think the risk is relatively small. Some people, if they wanted to do the surgery, they can do that. They do whatever they want. I don't care. It's not what I would do. If the only time I kind of would be reluctant to recommend, if someone was going to go and live on the Tibetan Plateau, weeks away from a hospital, I wouldn't give them the tincture to take. And under those circumstances, gallbladder surgery might be better indicated, because if they had an acute gallbladder attack that was really serious, which is very small risk, but if you're in the middle of nowhere and you can't get to a hospital, then you could be into trouble. So if I was living in a major city and I wasn't going into any remote villages, in somewhere in the world, then I don't. Worst comes to worst, if I had a gallbladder attack here, I could be in a hospital in under 10 minutes, living in Guelph or Toronto or something like that. So, there's risks with everything. Uh, connection here. Okay, can you guys hear me? I think I lost connection for a second. Uh, okay, where did my voice cut off? Because I'll just go answer those questions again. Could someone type in, Abida, can you let me know where it was cutting out? What thing was I talking about? Yeah, I turned the camera off because of slow connection. Where did I get cut off sound wise? I mean, you know. Okay, well, the beta glucuronidase, I'll just discuss that. Beta glucuronidase is an enzyme that certain bacteria have that's used to cleave a sugar or a glucose molecule off of some other type of chemical. What happens is estrogen, which is fat soluble, can diffuse through cell membranes. When you add a sugar to it, it now becomes water soluble and it's no longer able to diffuse through your bowel walls, and it'll be excreted in either the urine or the feces. And so if your bowels are kind of slow and you've got gut bacteria that are basically have the enzyme, the beta glucuronidase enzyme, then what will end up happening is they'll go and cleave the sugar off of it to digest that sugar and release the estrogen, and then that estrogen will then become reabsorbed into the body and can cause like hyperestrogenic states. And so that's just one way that sort of has an effect. We'll talk about that again later on. Michael's asking, when you suggest bitters to your patients to help aid in digestion, what instructions do you give regarding the timing? Should they drink it right before eating? So generally speaking, I usually tell people to try to take the bitters 5 or 10 minutes before they have the meal so that their digestion's primed before the food even shows up. However, sometimes people forget, or you don't think you're going to need it until after you've eaten a big meal and you've overeaten and you're like, oof, now I feel bloated. So you can also take it after a meal. Ideally, you want to take it beforehand if you can, but you can take it afterwards as well. It'll still work. It just might take a little longer if you can. Uh, and ask, would you recommend whole flax or always ground? I would recommend always ground because human beings do not have a gullet like birds do, so we don't have little rocks inside our little gullet that'll break down the seeds. So if you don't grind it ahead of time, then what will basically happen is those seeds will not be broken down in your digestive tract, and you won't liberate the lignans and the essential oils and stuff like that. And some of the fiber, like if you just add non-ground flax seeds to water, it will form some mucilage for sure, but it's even better if you grind it up. So I always recommend grinding it. And I recommend you grind it yourself and keep it in the fridge yourself. As far as laxative, Michael's asking, as far as aloe as a stimulating laxative, will you just eat the leaf without the gel raw? How could it be given to a patient? There are products that contain aloe resin in it. I mean, in theory, you could just eat the whole, eat the aloe vera gel and the leaf. So the gel would act as a bulking laxative, and the resin, the yellow insides, that's yellow and bitter, that basically is the anthraquinone glycosides. I don't know the dosage for an aloe vera leaf though, so you could end up giving too much and causing a lot of cramping pains or not enough. So like I said, I usually don't use anthraquinone glycosides, and if I did, I would want to make sure that I used the correct dose. So I might be more inclined to use a capsule for those guys. But you could use Senna Tea. There is instructions for that. I haven't seen the instructions for the aloe vera resin from, if you just pick the herb yourself, but I'm sure you can find something out there. So, Ju Young, apparently Michael said that I froze up during your question. So what I was saying is that I think the risks of someone having an acute gallbladder attack taking the tincture is relatively low, but it exists. I think there are risks associated with doing the surgery as well. So I've only seen one person have an acute gallbladder attack. while taking the tincture. It may not have been caused by the tincture. It may have just been coincidental because they had gallstones and they also had a fatty meal or whatever it was. So, like I said, I've been using bitter herbs for gallstones and digestion for at least 10 years now, and I've seen, and frequently too, and I've seen one person have an acute gallbladder attack. So I don't know how that translates into, uh, what the stats are like, but it seems relatively low. It's certainly not a common thing. 1 in 10 years is not that much, but I mean, I don't know how many patients I've treated with it. What do you think? Okay, another question. What do you think about boiling the flaxseed and consuming the slim? I'm assuming you mean slime. Would that be beneficial? Um, I've heard that if you boil flax, um, if you boil like flaxseed oil, for example, you can make linseed oil, which is a bit toxic. So I don't generally boil flax seeds and consume the slime, but in theory it would be beneficial, yes. You want to be careful that you don't overdo it, though, with the oils and stuff at high temperatures. There's some processing to make linseed oil, which is a furniture oil that makes it toxic. I don't remember what the process is, but I remember it involved heat. I'm getting a message on my phone. It might be one of the students. Oh, so Beta got kicked out of the room. I'm still going over time here. So I'll shut this down in a second. What do you think about boiling the flaxseed? Oh, I already read that. Does milk thistle increase the beta-glucuronidase enzyme in the body? If so, does it cause hyperestrogen? Okay, so Brandon, milk thistle does not increase beta-glucuronidase enzyme. It contains a beta-glucuronidase inhibitor. So it contains a phytochemical that basically blocks that enzyme so it doesn't cleave the sugars off of the estrogens. Okay? So I think I've got all the questions done here. I'm going to shut this off now and stop the recording.